And you're looking at the Diamond Princess cruise ship, which is now off the coast of Yokohama, Japan. There's more than 200 people on board that have been diagnosed with the coronavirus. Hundreds more confined to their cabins on quarantine. Welcome to Full Circle. I'm Anderson Cooper. The chief medical officer for Princess Cruises told passengers on that ship in a video message that the situation remains, quote, very dynamic. Meanwhile, on the last day, the number of cases worldwide jumped significantly just in the last day or so. I want to get right to our Will Ripley, who is in Yokohama, Japan. So, Will, what's the latest with the number of cases on board?
So there were another 44 cases, Anderson, that were reported, which isn't a big surprise as we've seen the number of cases jump up every single day. So now it's 219 people who are confirmed to have coronavirus. But I think what's most kind of disturbing about that number is that they've tested fewer than 500 of the more than 3,500 people who are actually on the ship. So a lot of the passengers who haven't been tested yet and might not be showing symptoms are saying, hey, you need to test all of us because, what if there are people on the ship that are, don't not showing symptoms but might have this virus, and if they don't get tested before the end of the quarantine, they're afraid they could, be an invisible carrier and bring it back to their, to their communities.
Why haven't they tested everybody? I mean, it's been a while now. Why? Do you know?
We have been asking the Japanese government, and what they've said to us is that they have limited number of testing kits and limited ability to process the tests. So like right now in all of Japan, they say they can only process 300 test kits per day, but they're trying to get that number up to about 1,000, and that's going to happen the day before the quarantine ends next week. The quarantine is supposed to end on the 19th, and by the 18th, they say they should be able to process 1,000 test kits per day. And they're also saying that they're going to try to test everybody on the ship, but that obviously means that they do that the day before people are supposed to get off. That's going to delay when actually people can get off the ship.
You've been following this now for quite some time, and you and I spoke about this a couple of days ago. And one of the things I was asking about then are the cases that are popping up now that we're learning about, are those people who have been infected all along, or are those new cases? Are those people who have received an infection while they're on the ship from others who are on the ship in quarantine? So I guess the question is, back then the answer was, well, no, the ship says there's no new infections. These are all just people who had it and are just showing signs now. But if not everyone's been tested, how do they know? How do they know it's not continuing to spread on the ship?
Well, that's a really good question, and I think the honest answer is they really don't have any way of knowing. They're only going on the best information that they have, which is that that this virus is spread either by touching a contaminated surface or by person-to-person contact. If somebody sneezes or breathes on you, you could catch it, which is why whenever people are allowed to leave their cabins, which only happens every few days for less than an hour, they have to put on a face mask and they have to stand 6 feet apart from each other when they're out on the deck.
And with the number of cases worldwide, I mean, it jumped a lot in the last day or so. And I understand that it has something to do with the change in the way the authorities are diagnosing the virus, or that's what they said?
Yeah. I mean, obviously the vast majority of the cases continues to be in mainland China, which is bearing the brunt of this and is also the epicenter of this outbreak. They're saying that they're changing the definition of how they classify somebody, confirmed to have coronavirus. In other words, not necessarily somebody who's had a test result come back, but also somebody who has symptoms and is being treated for those symptoms. But this is raising a lot of questions about, frankly, the credibility of the numbers that are being supplied by, the central, Communist Party in China, because we know that China likes to cook the books in their favor, certainly when they're talking about their economic numbers. Why would they not be doing the same thing when they're talking about the number of people with this disease? So to have such a massive dramatic jump in a day in saying, oh, well, that's just because we're changing the way that we're defining who a patient is. And they're also acknowledging, frankly, that, there could be a lot of people out there who might not be in the hospital because, we've talked a lot about how people who are relatively healthy might not need hospitalization. This might just feel like a really bad cold for them. So we might not really know, frankly, the true scale and scope of this.
I spoke a couple of days ago with a woman on this program who was on another ship that was supposed to dock at one point in Japan, and then it was supposed to dock in Manila. They've been on the cruise basically 2 weeks. No country had allowed them to actually dock. There was nobody on the ship who has coronavirus or has any symptoms, but just countries were afraid of letting any cruise ship dock. They finally got permission to dock in Cambodia. One of the things she said is that everybody on that ship, because nobody was infected, everybody kind of rallied together, and they could still, gather together and have meals together. And they were, still, the nightclub was open on the ship, the hair salon. What's so probably disturbing about being on the ship that you're following is that everybody has to stay isolated. So there's no sense of community or bonding because everybody's isolated in their cabins and can't really communicate. That's got to be so hard.
Absolutely. I mean, I don't know if you've ever been on a cruise, Anderson, but the whole, these cabins, a lot of them are really, really small unless you pay for one of the big deluxe rooms. But most people are in these really tiny, cramped cabins. And the whole point is, you go in there, you change your clothes, and you go back out, and you go to the shows, and you go to the bar, and you go to the casino, and you go to the midnight buffet. And in the case of the Diamond Princess, everybody just has to basically stay in these tiny rooms that haven't, been cleaned really since this whole thing began. I actually interviewed some parents of a young family. I interviewed the dad. He's traveling with 10 other family members. They're divided amongst a few different cabins. But, they've got 5 young kids with them, and they're all under the age of 8. And so, aside from, the video you're seeing now where they get to go outside once every few days for about an hour, which is they basically just run and stretch and try to enjoy the fresh air, the rest of the time they're inside their cabin. They're waiting for, the crew to deliver crayons and, arts and crafts supplies. And then, they use their bunk beds as trampolines. They're just trying to do anything they can to keep the kids happy and occupied. And I asked them, so what are you telling your children about why you're doing this? And they said, they're describing it as this invisible monster called the coronavirus that's outside. So therefore, we're going to stay in here, with mom and dad, and we're going to protect you. Actually, for the younger kids, at least in this family's case, Anderson, they actually were really enjoying the uninterrupted time with mom and dad. I frankly can't imagine what it would be like if you were with a preteen. Can you imagine someone who just wants to be as far away from their parents as possible, and then they're stuck
awful.
Hours and hours like this?
Yeah, that would be awful. Well, although frankly, the idea of a big monster called the coronavirus standing outside my room as a kid, that would have probably freaked me out as well. So
yeah, I think either way, there's going to be some issues here. Yeah.
Yes. I also like that if you asked, I've been on a cruise. I have not, because I am so shy. All I would do on a cruise would be to stay in my tiny cabin and just watch television.
Right.
That's what I would do.
And you might actually really enjoy porn. I don't know.
Right, exactly. It's really up my alley. Well, it just, the hearts go out to the people on that ship. I can't even imagine what it's like being stuck on that. We certainly hope it gets resolved soon. Will, I appreciate you continuing to cover it. We'll check in with you again. Want to move on to the goods? I'll share a story that highlights the positive work that a lot of people are doing in their communities. Basketball legend LeBron James is once again paying homage to his Ohio roots. His foundation partnered up with Kent State University to announce a thrilling surprise for the inaugural graduation class at the I Promise Public School, which James opened in Akron.
We're announcing today that we will guarantee your tuition will be free at Kent State University, and your first year of room and board free.
The 11th grade class erupted into cheers at the ceremony during a class trip to Kent State as family members fought back tears in another room. 193 students will be eligible for the full scholarship. James, who grew up in Akron, started the I Promise School 3 years ago to provide opportunities and support for the most at-risk kids in his hometown. Congratulations to these future college graduates. They've earned high honors here on The Goods. That does it for Full Circle. We'll be back 5 p.m. Eastern Time tomorrow. Remember, you can stream the show anytime by going to cnn.com/fullcircle.